remind everyone, the board was asked by Representative Etchart from Billings to consider scheduling Kratom, the 7-OH, 7-hydroxymetragenine. That was her request. There had been some discussion of this through the legislative process in 2025, but the legislature took no action on kind of a overarching Kratom bill or for study. We talked about that in December. As a reminder, Kratom is an unregulated botanical product sold in various retail settings that are not licensed or regulated by the Board of Pharmacy, and it is also not any variation of an FDA approved or regulated product. Since the board's discussion in December, in which we left it as potential next steps of taking a rulemaking, either schedule the 7-OH version as a Schedule 1, which means it would not be available to the public. There was also discussion of scheduling all of Kratom, natural and synthetic 7-OH. That would ban the entire product. But again, the board does not regulate the entities in which this product is sold. And the other option is, continue monitoring or take no action. In December, the board was kind of the only entity continuing this discussion since the legislative process. And we very much appreciate Representative Etchart and Representative Nickel bringing it to our attention and the dialogue that we have had throughout this process. I do want to highlight some very significant and important discussions that have happened since our December meeting. And that is 3 legislative interim committees at least have been discussing the Kratom issue, including the Legislative Oversight Committee for the department, including the board, which is the Economic Affairs Interim Committee. Again, this is our oversight committee through the legislature. January 20th, 2026, Economic Affairs Interim Committee held an extensive meeting talking about Kratom. They also referenced other interim committees. And then there's multiple other state agencies or departments engaged in those discussions. That includes Montana Department of Revenue, Department of Agriculture, Department of Public Health and Human Services, and finally, Department of Justice. In those discussions, it's important to highlight the fact that the legislative interim committees are looking at a comprehensive process and program that can stand up a regulatory environment for Kratom, in which there may be retaining access to natural or maybe tea liquid-based Kratom, and banning the synthetic condensed 7-OH and other variations of that. Those are healthy discussions, and we very much appreciate the legislature taking their interest. Related to that, in your board book, there's a letter to government entities and local authorities from a variety of our legislative colleagues, identifying the legislators' commitment and interest in taking on this topic and looking at the comprehensive and overall regulation of Kratom, again, potentially preserving the natural pathway, potentially banning 7-OH and other synthetic variations. Also potentially putting in an age restriction for who can purchase the product. That would be natural based on where the tendency is going here. But then also if there's a percent that is allowed based on the natural components of Kratom and how it can be available from entities, again, not licensed by the board, and then maybe distributed again by distributors not licensed by the board. We've received some good feedback from certain distributors that are currently in this space and the business opportunity that they're finding. I think one of the biggest challenges the board continues to have with this topic is trying to assess the economic impact analysis for a rulemaking perspective. That's a requirement that the board have an economic impact assessment for any rule that we address. And we do not regulate the entities selling these products. We've had some good conversations, but I'll have Ms. Delkamp provide us with some additional insight on how the board might accomplish that. But we're still at an area where we do not have enough information in that regard if the board were to take an action. I want to highlight a few other things provided to you. A letter related to Yellowstone County and their attorney with activity of Yellowstone County looking to ban Kratom in food establishments that they license at the county level. That was from the end of January. So again, we didn't have that back in December. They're looking to ban all Kratom products from regulated food establishments, by March 31st. And then finally, we've got a comprehensive list of regulatory or legislative activities included in a summary of state laws, April of 2025, from the Legislative Analysis and Public Policy Association. It talks about past other state legislative activities. 11 states took some sort of an action in 2025 based on the 34 that had considered such action. In addition, Ohio Board of Pharmacy did take an action. They're a little bit more, they've got a little bit more law enforcement oversight of them, but Ohio, I did not include this in your book, but we discussed it at the last meeting. In December, Ohio banned the 7-OH product through ultimately executive order with the governor on recommendations of the board. I do want to acknowledge the multiple public comments that we received via email. Some of you may also be on this call. The board has received some of them, but the stuff that has come in the last 2-3 days and this morning, I want to acknowledge we received it, but it has not been provided to the board yet. I'll stop there and see if Ms. Delkamp has any additional updates or information for the board before we move on. Thank you.
Thanks, Marcy. Just wanted to remind board members when you are evaluating under your current statutory authority whether or not to schedule a new Schedule 1 or a new adding a drug to your drug schedules. You need to consider the actual or relative potential for abuse, scientific evidence of pharmacological effects, if known, state of current scientific knowledge regarding the drug, history and current pattern of abuse, scope, duration, and significance of abuse, risk to public health, the potential of the drug to produce psychic or psychophysiological dependence liability, and then whether the drug is an immediate precursor of a drug already controlled by the Controlled Substances Act. And to help you with that decision, if you should determine that you want to pursue rulemaking, you are going to need someone experienced and expert in the scientific evidence of the pharmacological effects and the state of current scientific knowledge regarding the drug. Your executive officer is a very smart woman, but this is not her area of expertise. And to that end, she and I have located several pharmacological experts who are academics and are happy to engage them as an expert on behalf of advising the board. We have also reached out to our economist group housed here within the Department of Labor to gather some further information on the small business impact to distributors, to local retailers, that sort of thing, if the board is interested in moving forward with rulemaking. I had one other thing I was going to, I do see we've got some folks both from the legislature and from the distributor realm.
Industry.
Thank you. Who are on here today to make public comment as well.
Yes. I do want to, my final update is just remind everyone in your board book is the letter that we received from the legislature outlining their commitment and interest in addressing a comprehensive regulatory oversight pathway for this product. And again, recognize the many public comments that we've already received, continuing the discussion from our December meeting. I'll stop there and I will call on Senator Usher for public comments to make our first comment. Senator Usher, go ahead.
Sorry, just trying to find the technology. Senator Barry Usher, USATR from Senate District 19, which is north of Yellowstone County, Fergus County, Muscle County, Golden Valley County, and Petroleum County. I'm also a member of the Law and Justice Interim Committee, who's also taken this up. And I'm also the president-elect for the National Conference of State Legislatures. So I have, with my NCSL hat, I have had discussions with the federal government on what they're doing on natural leaf kratom versus the synthetic. Right now, I've actually had a couple conversations trying to clarify their public stance on natural leaf kratom. Right now, they are trying to go after the synthetic, and they would like it to be scheduled. The natural leaf kratom, they have no problems with. I'm supposed to talk next week with the scientists, so I can learn a little bit more about the science behind that. I'm also talking to some other agencies that are responsible for scheduling on the federal level, and they are trying to get the synthetic 7-OH to be a scheduled run. There's no studies out there that say the natural leaf kratom has any negative effects on humans. I do have 2 sample bills that I've gathered from other states that we will look at for the next legislative session. I do believe that your board should do nothing at this time until the legislature can take an act on our next legislative session. But I will say on the Yellowstone County issue, talking to the federal government, natural leaf kratom is actually defined under dietary supplement. And I believe Yellowstone County is not using that definition, and they're citing, I think, food additives. Natural leaf kratom is not a food additive. So I think they're wrong in their decisions. Ohio also did make a decision, but that was also based on false data because there's so much confusion between natural leaf kratom and the synthetic. And some of the statistics that were cited in the Ohio Pharmacy Board meeting was really talking about synthetic when they said it was the natural leaf kratom, which was false information. Again, the confusion between the two is what we need to figure out as a legislature, so we can, really ban what needs to be banned and make sure that the natural leaf kratom can move forward, because there is no study out there that says there is anything wrong with natural leaf kratom. So again, I'm asking your board to hold off and let the legislature do what they're supposed to do on this, and we as a group, we're continuing to try and find out more information, find out the actual science behind the synthetic versus the natural leaf kratom. Thank you.
All right, thank you, Senator Usher. We appreciate your comments.
I think you can just start at the top.
Okay, we'll start with, we'll just go in order of raised hands. Melody Wolf.
Hi, thank you so much for letting me speak. I live in Kalamazoo, Michigan, and what I'm coming to today is to ask you to follow the federal guidance on Kratom and 7-OH. I just returned from the 5th Kratom Scientific Symposium at the University of Florida Research Center. There were regulators and scientists from every single healthcare agency. A ban was never discussed about Kratom beyond an age gate. Now, what they discussed a lot was getting rid of 7-OH, and that I would fully support. Our keynote speaker was Dr. Nora Volkow of the National Institute of Drug Abuse. She's the director, and she gave the same favorable stance on Kratom that she gave in 2023 to the U.S. congressional briefing on Kratom. And this is also aligning with my experience in July of 2025, where the FDA and HHS invited me to speak on their stage as a daily, at that time, 11-year Kratom consumer about the benefits of Kratom and to distinguish it from 7-OH. And again, I cannot urge this enough, get 7-OH off the shelves, because that is not what is helping like me. 7-OH is a full-on agonist, and Kratom is not 7-OH, and it is wrong to put the label of Kratom and 7-OH. So I'm so glad that your committee is distinct. As I said, I've been taking it daily for 12 years. I was bedridden for 8 years. I've been pretty much in pain for 20 to 25 years daily. And entered Kratom, I no longer need mobility aids. And I'm able to be a really good mom to my adult children, because when they were home in elementary school for 8 years, their mom was bedridden. And they had to have a fan on in their room at nights just so they could sleep. And now it's a pleasure to be a good mom to them. Last summer, I spent 4 months chasing my 3.5-year-old granddaughter around the zoos. The same zoo where my kids pushed me in a wheelchair, I was chasing my 3.5-year-old granddaughter. So please follow the federal guidance. Thank you for your time. I really appreciate it.
All right, thank you, Ms. Wolf. I'm going to see if Representative Lear is on. We think that he is.
Thank you. Can you guys hear me?
Yes, go ahead, Representative Lear.
Thank you. I would like to clear up a few things that were said earlier that the legislature did not take action on this. We actually took action 2 different bills. Both of them bills were had failed to pass, but that is still legislative action. And also all interim, whether it's been the Economic Affairs, the Health and Human Services Committee, and the Law and Justice Interim Committee have been taking this, and I believe that this is a legislative action and not an action that needs to be taken by the board at this time. And with that, you'll also, if you're making rules, you as a board will have to come in front of one of these interim committees to make sure that these rules get passed. So I think it would be wise of you guys to make sure that you are in contact with us and the appropriate committees that you're going to have these rules come in if you even want to see these rules passed. And I'm the chair of the Economic Affairs Interim Committee and the Speaker of the House, and we have all made it known that we want to take action on synthetic kratom. There are 2 bills out there right now, one that Barry Usher's discussed on the national level and one that we've drafted in the last session that only failed because we didn't have the appropriation piece correct on that bill, and that is to ban all synthetic kratom and age gate natural leaf kratom. So I believe at this time the board's best action is to leave it up to the appropriate process, and that would be legislative. So with that, I appreciate your time and thank you.
Right, thank you, Representative Lear. And yes, I appreciate your clarification that there was legislative action on the potential bill and the study bill in review, just nothing passed. So yes, thank you for that clarification. And we did discuss those in length in December. All right, I'm going to pause and see if there's any other legislators on the phone or on Zoom that we've not called on. Senator Usher, do you have any additional comments? Your hand is still up, but if not, that's okay. We'll move on. Got it. All right, so I do want to coordinate a little bit, given the number of hands. We'll go in, if you can keep your hand raised, if you're in support of board action, and we'll start with those. If you're opposed to board action, lower your hand and we'll come back to you. If you just want to make comments, we'll hit those third. I should have clarified that when we started. We'll treat this a little bit like the legislative hearings. So we're going in proponent, opponent, or informational. Seeing hands still raised, I'll go to Dan Gibbs.
Hello.
Yes, go ahead.
Good morning. My name is Dan Gibbs. I'm here because my 25-year-old son died after using natural kratom leaf products containing mitragynine. Postmortem toxicology detected mitragynine and did not identify the illicit opioids, including fentanyl, prescription opioids, or other prescription medications, synthetic opioids, alkaloid concentrated kratom products, or 7-OH. Autopsy findings included frothy airway secretions and pulmonary edema, findings commonly seen in opioid-related respiratory failure. His death was determined to be consistent with opioid-type toxicity, and the official cause of death was solely by mitragynine toxicity. Under Montana's statutory 8-factor analysis for controlled substance scheduling, kratom's opioid receptor activity, documented dependence, liability, and demonstrated risk to public health warrant formal evaluation. Other boards of pharmacy, including Ohio, are currently undertaking rulemaking to evaluate and schedule mitragynine, including natural kratom products, under their controlled substance authority. I respectfully urge the board to initiate rulemaking to evaluate kratom under Montana's controlled substance scheduling criteria. Thank you.
Thank you. We'll move on to next comments from Beth Price, excuse me.
Yes, good morning, Chair and members of the Board of Pharmacy. Can you hear me okay?
Yes, go ahead.
Perfect, thank you. My name is Beth Price and I work in youth substance abuse prevention here in Montana. My role is to focus upstream before addiction takes hold, before emergency rooms fill, before families are shattered. I plan on speaking briefly, but from a prevention lens, kratom follows a pattern we recognize all too well. It's easily accessible. It's attractively packaged and widely marketed. It is framed as natural and therefore safe. For adolescents whose brains are still developing and whose perception of risk strongly influences behavior, that messaging matters. When young people believe something is low risk, use increases. And prevention science has shown us that very clearly. And prevention is about reducing the availability, reducing the normalization, and reducing youth access before use becomes widespread. If we wait until kratom use among Montana's youth is well established, we are no longer preventing, we are reacting. And our reaction is always more costly than prevention. You're going to hear from families who have lost loved ones where kratom was a contributing factor. Those testimonies are not statistics or abstract policy debates. They are the human cost of kratom. They are the voices of people who would give anything to have one more safeguard in place. Prevention exists so that fewer families have to stand where they are standing today. I also want to be clear that anything from a prevention standpoint, anything short of a total ban leaves that door open. Partial restrictions, age limitations, or labeling requirements may sound reasonable, but they create loopholes that are easily exploited. Products shift categories, marketing adapts, access finds a way. We have seen this pattern before with other substances, and if your goal is to prevent youth initiation, the most effective approach is to eliminate availability altogether. I urge the board to weigh carefully the motivations behind the testimonies you are hearing. Those of us in prevention, public health, education, and recovery do not stand to gain financially from a ban. We are not here to protect a product. We are here to protect young people, our families, and our communities. When you deliberate, I ask that you place greater value on testimony grounded in youth safety and public health rather than commercial interest. One side note too, if we wait for the legislature to take action, there's no guarantee that that will happen. And we have had 29 deaths in Montana since the year 2000 related to kratom, and I don't think we should wait another minute over the next year and a half to see if there's more. So thank you for your time and commitment to safeguarding the next generation of Montanans.
All right, thank you for your comments. We'll move next to Kelly McCann.
Good morning, Chairperson and board members. Thank you for giving me the opportunity to speak today. My name is Kelly McCann and I live in Fairfield, Montana. And I am in support of banning Kratom in its entirety. I attended the December 5th board meeting where I shared about the loss of my son, Benjamin, who died from acute mitragynine and intoxication. And I have read his autopsy and toxicology reports over and over again. So it was verified by that. And I never imagined I would have to fight this hard to simply protect others from the same fate. I had no idea of Kratom's past and current controversy. My son, he was an advocate for Kratom when the DEA attempted to ban it. And I found one of his comments on Facebook, and it was, Kratom is as benign as coffee. And that is a statement I have witnessed over and over again from Kratom advocates. My son's toxicology and death certificate prove otherwise. I have yet to see a debate about whether or not we should ban coffee to ensure public safety. Kratom is mitragynine and 7-OH among the other 40 plus alkaloids. They are a part of the whole. And if we do not ban Kratom in its entirety, we will continue to risk public safety. We are now seeing the increase of these tragic consequences of ignoring the warnings in 2016. It is why we are here today. And when I seen the cause of my son's death and I read all the controversy, I really wish that they would have did something in 2016. It might have prevented some of this. Idaho yesterday just rejected a KCPA because one of the senators now that he said it was written to protect this industry. The deaths are denied. It's blamed on the coroners, and I even seen recently blamed on the emergency room physicians, the medical examiners, that they're all wrong. There's been constant blame since in 2016 this started. And we had our first mitragynine death in 2017 in Montana that this man's name's never mentioned. So it started way before this 7-OH stuff. This is just another thing to blame. And so please do not allow these tragedies to continue. Thank you for your time and consideration.
All right, thank you for your comments. We'll move on to the participant identified as Susan.
Hello.
Yes.
I'm sorry,
Two
Susan.
Oh, Susan with,
Susan.
Susan with a picture of one person, not two people.
Okay. That's Susan Eppard.
Hello.
Would you?
Susan, yes, go ahead.
Yes, my name's Susan Eppard, and I support banning all forms of Kratom. I don't support the KCPA because it gives the false impression that it's safe. And I'm here on this call today because my 22-year-old son, Matthew, died from natural whole leaf Kratom powder, which is the least potent form of Kratom available in the United States. Kratom caused him to have a seizure, go into cardiac arrest, and die on his kitchen floor in front of his girlfriend. His toxicology showed he died from the toxic effects of mitragynine, which is an alkaloid found only in Kratom. He had no prescription drugs, no street drugs, nor alcohol in his system when he died. His autopsy showed he had no underlying health conditions. It's important to note my son did not die from 7-OH or 7-hydroxymitragynine, as he died in 2021 when 7-hydroxymitragynine didn't come out until late 2023. And the argument that restricting Kratom will push people to fentanyl is speculative and fear-based. Public policy cannot be driven by hypothetical behavior. What is documented is an unregulated market selling increasingly potent Kratom products with no dosing standards, no purity requirements, and no medical oversight. Conditions that have resulted in dependence, emergency department visits, and deaths involving mitragynine. I belong to a nonprofit group, Kratom Danger Awareness, a group comprised of people whose loved ones died from Kratom, and many have died with only Kratom in their system, and some with just small amounts of alcohol or with Kratom, Benadryl with Kratom, antidepressants with Kratom. And I've been in this group for about 4 years, and to constantly have add more and more people to this group has just been devastating to me. And I spoke with the FDA regarding my son's death. They assured me they are actively investigating all Kratom injuries and deaths from Kratom that have been reported to them. And Kratom is deceptively being put into seltzers and gummies and candies to cause addiction to unsuspecting consumers. Does Kratom relieve pain and make you feel euphoric? Maybe so, but so does heroin, methamphetamines, and cocaine. And we don't sell those out of gas stations with unlimited supplies to the consumer. And the FDA has not determined Kratom to be safe, as demonstrated by their import alert 5415 on Kratom, make it illegal to import into the United States. Therefore, all Kratom imported into the United States has been smuggled in illegally, according to the FDA. Their slow action against Kratom powder is not an indication they think it's safe. Please look at the FDA website and don't believe the Kratom industry when they say the FDA thinks Kratom is safe. And thank you for your time, and the life you could save could be someone you couldn't imagine to live without. Thank you.
Do we need Susan to spell her last name?
Yes, Susan, could you spell your last name for us? I know you just
Yes.
took your hand.
Yes, it's EPPARD. And I can also supply my son's toxicology and autopsy results as well.
That's fine. If you'd like to provide that to the board, that's fine. Thank you for the offer.
You're welcome.
Senator Usher, your hand is up. Do you have additional comments?
I think he just.
If
did not lower
not,
his hand.
that's okay. We'll move on to Jay Yeager.
Good morning, Montana Board of Pharmacy and other respected guests. As mentioned, my name is Jay Yeager. Last name is spelled Y-E-A-G-E-R. I want to thank you for the opportunity to speak to you this morning. I've been waiting months for this meeting in anticipation of the positive impact that you as a committee can make in the lives of others. During this waiting period, much has happened across Montana and the United States in the area of Kratom regulation and elimination. I've supplied a few supplemental material for the committee to look at your convenience. But during this time, more people have passed away, even toddlers. The Berkeley County toddler had overdosed on Kratom last summer, needed to be revived by Narcan. There is evidence of newborn babies being affected by Kratom. They are now cord testing for Kratom in the birth of newborns. The Navy and the Marine Corps have banned Kratom. Several states, even countries and counties have either banned it or are moving forward to ban it. Our clinics have been overrun. Our hospitals have more patients. Support groups have been increased. More Kratom crime has been committed, and numerous other devastating effects that this mislabeled, misinformed drug has caused. I'm one of the ones that some of you might call the lucky one. And I say that because my son is still alive. You're going to hear from parents this morning who have lost their children to this horrific street drug disguised as a natural supplement or special tea or health food drink. I'm lucky because I can talk to my son today, but it's not without God's graces. He is not the same young man I knew before Kratom took over his life. He is fighting his addiction every day, and the lasting after effects that his sole use of Kratom and 7-OH has had on his life. His hands shake constantly. He cannot stop that. And he has other health effects that are yet to rear their ugly head. You will likely hear from Kratom advocates some nonsensical bloviating from those non-residents of Montana that promote the use and sale of Kratom, just like their misleading packaging of the drug, their false claims of health benefits made to help or promote the sale of Kratom. You too will hear misleading and false information presented by these pro-Kratom advocates. They will claim health benefits. They will claim bogus studies resulting in their favor. They will make claims the drug is non-addictive. They will even claim scientists and medical examiners and other professionals have got it wrong. Do not be persuaded by their ramblings and corporate greed. No amount of money is worth the devastation this drug is causing across the United States and within the state of Montana. As a committee, you have the authority, you have the knowledge, and you have the heart to do what is right by our citizens. Ban this drug in our great state and protect our reputation and our livelihood and the good health of future generations. My son has now spent 40 days in rehabilitation from Kratom. It's only after his near-death experience that forced him to realize the addictive nature that Kratom has. He cried in my arms one day and pleaded for help with his addiction to these drugs because he could not quit himself. He spent his last dime on drugs. He had no insurance. My wife and I covered the roughly $50,000 needed to experience this 40-day treatment, the daily intensive outpatient rehabilitation he now has to go through, the sober living environment that he has to live in, and the constant continual education needed to quit using Kratom and 7-OH. During the time that we visited my son in treatment, my wife and I met with other parents that were suffering similar situations from other abusive drugs. Not one of them in the roughly dozen parents had ever heard of Kratom, nor did they know it was being sold at the gas station or other neighborhood convenience stores. One of the parents caught me out on break, and he asked me to clarify the name of the drug. And when I told him, he gasped at me and he told me the story. He said he and his 14-year-old daughter were just in the gas station in Helena, Montana, about to check out, and his daughter placed a health drink on the counter. Fortunately, the clerk had asked Dad if he knew what was in this beverage. And after further explanation and clarification, they were able to make the right choice and place it back on the shelf. 14 years old. Apparently, she didn't know what it was either. She was simply motivated by the packaging and the health claims that were made on the display. I'm proud to say that as of today, my son has been sober 120 days. Any addict will tell you, however, that he's just beginning, and much of his fight is yet to come, all because of Kratom. He still has his constant shakes in his hands that he started to get when he started using. Those tremors have not gone away. He attends meetings every day, sometimes twice a day, something I'm told that he will likely have to do the rest of his life. He has a full-time job with a reputable company and now lives in a sober living house with 10 other gentlemen fighting for sobriety. He is deeply in debt with no transportation, but he's alive. And for that, I'm grateful. It is my belief not enough citizens are aware of these drugs being sold in their cities and neighborhoods. If they did, I believe the opposition would be much greater than a few grieving parents and healthcare professionals fighting to eliminate the sale and use of drugs in our state. I believe this to be true of our political partners from Montana as well. I don't think they're well aware of what the devastation is causing. As I have written to our state and local senators, our House of Representatives, my local district representative, the governor, the district attorney, the former mayor of Billings, the local newspapers, several television stations, and the CEO of Riverstone Health. And I can count on one hand those that responded. Former Mayor of Billings, Mayor Cole, he reached out immediately with an email. Riverstone Health CEO John Forte responded with all the help his organization could provide within the limits and the boundaries that he represents. Representative Nellie Nicole and Representative Curtis Schomer also responded with sincerity and concern. But beyond that, only 2 of our political partners placed me on their mail list and thanked me for my concern. I imagine, though, as this damage deepens and the real life cases start hitting closer to home, more people will realize the bizarre nature of how a manufactured drug can be quietly made and slipped into our economic stream untested and undetected. I believe somebody or something or some country is trying to dumb down America with these manufactured opioids. Let's not allow that to happen in Montana. If my time today helps just one person understand the devastation and deception that this gas station heroin is causing, it will be worth all the shame and embarrassment that I feel. Please understand this highly addictive, unregulated, non-approved drug is not helping, but rather causing long-lasting damage to some of the citizens and visitors of our great state. If after proper governmental studies are done and approved, and the drug is sold and prescribed through our medical professionals, then maybe it should be considered a possible alternative at that time. But until that has taken place and been determined, you as a board must consider the immediate elimination and ban on the sale of these illegal drugs. What is next? What other drugs are on the way to Montana only to follow the same path? Montana is known as one of the last best places on earth. Some would say God's country. Montana should not be a state where you can cross our border to obtain your drug fix. I appreciate all you do to protect Montana citizens and help regulate the pharmacy industry. I truly do. And I'm grateful for your time today. I appreciate you listening and considering everything I've had to say. Thank you.
All right, thank you for your comments. We'll move next on to the participant identified as Holly with your hand up.
Hello, can you hear me?
Yes.
I'm on one phone call. Hi, sorry, thank you. My name is Holly Truval, and I am speaking
Holly, can
as
you
a.
spell your
Yep.
spell your last name, please?
Yep, T as in Tom, ROU, V as in Victor, ILLE. I'm from Massachusetts.
Okay, go ahead.
My name is Holly Truval, and I am speaking as a mother who lost her only child, her 25-year-old son Tyrell, to metragenine toxicity, not 7-OH, on February 6, 2024. He drank a Kratom seltzer, marketed as alcohol-free, caffeine-free, and sugar-free. That was his sole cause of toxicity, with no secondary causes, no opioids in his system. I have a toxicology report to prove that and a death certificate. It was ruled solely an accident by the coroner. His death has destroyed my life, and I never want to see another parent's life destroyed by something that should never be marketed as safe or natural. Already in Montana, the Blackfeet Tribal Business Council has banned the sale, use, and possession of all Kratom since August of 2025. As stated on January 6th, Ohio initiated permanent rulemaking to classify all Kratom, natural and synthetic substances, as a Schedule I under its controlled substance framework. Also, 2 days ago, Connecticut just scheduled all Kratom as a Schedule I drug as well. Literally, if you go on the FDA website, there is only one FDA-funded single ascending dose study to evaluate the effects of botanical kratom ingestion in humans. That has yet to even be peer-reviewed. The only other thing is that the FDA awarded a grant for a human abuse potential study on kratom in September 2024. Those results won't even be into effect until the end of 2027. Any other study you hear about today completed was not funded or done by the FDA. Montana's statutory criteria mirrors those used in Ohio, including evaluation of pharmacologic effect, abuse potential, dependence liability, and public health risk. Ohio's action demonstrates that the boards of pharmacies are not required to wait for legislative action when controlled substances standards warrant review. Lastly, everyone that says Kratom has saved their life, they cannot produce a note from a physician agreeing with that. It is solely their personal opinion. I have a letter from a doctor stating that Kratom took my son's life. You cannot fight that, nor can you argue that. Therefore, I implore you to initiate formal rulemaking to evaluate Kratom under Montana's controlled substance scheduling criteria. Thank you for your time.
All right, thank you for your comments. We'll move next on to comments opposed to the board taking any action. Please raise your hands and we'll call on you.
I have 6 hands raised.
Okay, as I see. We'll call on Mac Haddow.
Thank you, Mr. Chair and members of the board. My name is Mac Haddow, H-A-D-D-O-W. I'm the Senior Fellow on Public Policy with the American Kratom Association. We represent the 24 million Kratom consumers in the United States. We do not represent the industry and in fact have referred more than 100 Kratom manufacturers to the FDA for action for making unverified and unconfirmed therapeutic claims not backed up by a new drug application approval. And we've reported the 7-OH companies for their unverified claims inducing and misleading consumers about Kratom. 7-OH is not Kratom, and there is enormous confusion about that that needs to be addressed carefully. And we deeply appreciate Speaker Lair and Senator Usher for indicating and giving you the pathway that they will be evaluating this carefully in the legislative process. But that confusion that I mentioned has permeated the community, and even Ms. Price, who spoke to you about the substance abuse community, they themselves have a divided community about exactly the differentiation between natural kratom leaf and properly extracted products and those adulterated products, which include 7-OH. I would concur that natural does not mean safe. That is why we have advocated for and successfully have had 19 states that have implemented a Kratom Consumer Protection Act, and we hope that Montana will join, which assures that kids do not have access to any Kratom product. It is age gated, and the same way that you restrict alcohol and tobacco products, you should restrict Kratom as well. Our bill includes limits on product formulations. There are ways that Kratom itself can be extracted not using FDA-approved food-grade solvents that produces a dangerous product, and I'm sure that many of the tragic stories that you've heard about were caused by those kinds of adulterated products, not naturally Kratom. Labeling is important. Consumers need to know what the risks are, what the exact serving sizes are that are recommended, because these products need to have the benefit for consumers. The 8-factor analysis that was referenced earlier has already been conducted at the federal level, and it is the determination of the Food and Drug Administration, the Department of Health and Human Services, including the support of the National Institute on Drug Abuse, that 7-OH should be subject to scheduling, emergency scheduling with the Drug Enforcement Administration, and that is under review currently. In the context, and to provide you the context, when asked specifically at the press conference on July 29th of 2025, Commissioner McCary of the FDA said, "We are not focused on natural kratom leaf products." There's a reason why. Because the FDA has in fact conducted a dose finding study, despite the attempt by one of the advocates who suffered a tragic loss to disparage